Right from the start, we set out to build a bed that provides the highest therapeutic results, while at the same time being simple and easy to use. To achieve this goal, we collaborated with hundreds of doctors and medical staff from across Europe. Their suggestions and feedback went directly into the design process, and thus the Multicare was created. Our goal was to develop a bed that would help prevent respiratory complications, be easy for staff to operate, and ensure maximum patient safety. One of the bed's key innovations is the automatic lateral therapy function. During therapy, it is crucial that the patient is positioned at enough of an angle and that this is maintained throughout the therapy. On the multi-board, for example, it is easy to appreciate our approach to designing practical products. The design is the result of nursing staff recommendations on how to make a more ergonomic, user-friendly bed that offers simplicity and ease of use. We had to study their work environment very carefully in order to create such a design. Thanks to its unique location on the head end, the multi-board is easily accessible and gives a clear picture as to the angle of the backrest, letting the nurse easily see if the bed is in the recommended position. We focus on simplicity, user-friendliness, and intuitive controls, where every function has a specific purpose without overcomplicating the product. The X-ray cassette can be inserted directly into the bed frame. It has been designed so that the patients in critical condition needing X-rays do not need to be transferred. The design of the side rails was given special attention. We wanted them to be highly effective and provide the patient with the highest amount of safety possible. This led us to create high side rails made of smooth, solid plastic that is easy to disinfect. For the overall structure of the side rails, we applied the new minimum gap concept. Unfortunately, clinical care complications so often cited in professional studies regularly present in day-to-day clinical practice. Some of the most common issues include nosocomial infections and other problems while providing care, such as pressure ulcers or injuries from falls. These complications significantly prolong hospital stays and significantly increase a hospital's costs. I'm glad I could contribute to the development of the bed, which helps to provide solutions to these common problems. The Virtuoso helps eliminate the pressure applied to soft, vulnerable tissue, which is the direct cause of pressure ulcers. Those particularly at risk are unconscious and long-term immobile patients. The Virtuoso cyclically reduces the air pressure in the mattress cells to 0 in 7.5-minute cycles. This cycle is based on an awareness of the mechanical causes of pressure ulcers and a study of the natural movement during sleep. We need devices that are easy and safe to operate. It's simple. The less time staff devotes to operating the bed, the more they can dedicate to direct patient care. Ultimately, the fewer the complications, the lower overall cost of treatment.
From my own experience, I know that many nurses develop back problems. The Multicare can be set to 15-degree angle, which makes it easier to handle patients who are unconscious and to perform specific nursing tasks. In addition, the bed can also be positioned with foot pedals, leaving both hands free to deliver patient care. For caregivers, the bed's biggest advantages are the automatic features, such as automatic lateral therapy, which after setting the program, positions the patients by itself. Also the integrated scale, which then displays the patient's current weight and trends over time. When transporting a patient in bed, a fifth wheel automatically engages to improve the bed's handling, thanks to the iDrive feature. Once the bed is plugged back in, the iBrake automatically locks the casters, which gives us confidence that the bed is always secure. The mobile lift handle is important not only for nursing staff, but also for patients. In my view, it actively supports the whole process of getting up and getting back on your feet, not only physically, but also mentally. This can be the first positive sign of a patient's renewed independence.
Since the beginning, our vision has been to develop and manufacture beds that really help healthcare professionals. At last, after 20 years of hard work, we have developed Multicare. This, as I see it, is the future of hospital beds for high acuity environments. The fact that Multicare comes standard with these features and has an exceptional design is not so important. What is important is that it allows for higher quality of patient care and a faster return to normal life.